I promise to make this informative, educational, and fun. Throughout med school, like the way I got through med school was like fun analogies, like group visit, like group discussions, and not just like the rigor in science and like nitty gritty. So I try to make that for individuals with education. All right. Well, welcome to Iron Deficiency Treatment, presented by myself, Michael Henderson, medical doctor and board certified in lifestyle medicine, also Trails to Health. If you have any problems with audio, any problems with video, have any questions, drop them in the chat. That's the absolute best way to communicate throughout this, and you will get this recording after. So, iron deficiency anemia, we're going to start kind of like an outline, and we'll talk about um, the prevalence of iron deficiency anemia. So first of all, 30% of those in the world have iron deficiency anemia, iron deficiency. There's different types of iron deficiency. There's simply iron deficiency. There's iron deficiency anemia, where you actually have a decreased number of red blood cells in the body. Um, and individuals that are pregnant or menstruating have a higher prevalence of iron deficiency. So I have a little story slash analogy. I think it's really helpful to kind of think about iron in this way. Um, and so I'm going to share it. Oops, sorry. I'm going to share this, and so you can kind of just follow along. So I like to think of iron in the body as an analogy in the city. Children are needed because their smiles light up the, store clerks. They light up the teachers in school. So you got to transport these children around to be able to help there be a happy city. Cars you use to transport, and more importantly, is inside those cars are car seats. So if there's adequate cars, there's adequate car seats. We get to move these children around. Um, the cars are symbolized or represent red blood cells. Okay. They're going to carry the children, but specifically that part of the car that carries the children is the car seat. And that represents hemoglobin. Okay. And that actual child is the oxygen, because we need oxygen throughout our whole body. To make up that car seat, you have, plastic and, what do you call that? Material. Well, that plastic is iron. You have to have iron to have a car seat. You have to have iron to carry oxygen around the body. So a lot of individuals may come to me and they say, I am just fatigued. Well, one thing that we look for is, do they have adequate iron? One more small part of this analogy is, lo and behold, we do have, see this cross right here? There it is. You can imagine this as a spark. We have Walmart in this city. And the reason we have Walmart in this city is because there's a supplier. There's a supplier of these car seats. And we'll come back to that, but that's an important element to monitor. Monitor how is your iron status. I'm gonna actually go into it right now. A huge lab that a lot of medical professionals will state is the ferritin is a fantastic lab marker to learn if someone has iron deficiency. And the ferritin, if you remember, is Walmart. It's that supplier. Because think about it, if that store was absolutely no car seats left, what does that mean for the cars? There's less car seats. There's less children being transported. There's less smiles in the city. And so if we check the store, we can be able to see how your body level is doing. So that's kind of an example here that we'll come back to periodically throughout this throughout our discussion. All right, so kind of an outline. This is going to go here. Outline of today. What we're going to talk about is we're going to talk about how much iron do we need, and I'm going to move so you can see me. See the how much iron do we need? Where can we get iron? Talk about supplements versus IVs versus foods. What helps and hurts iron absorption. And this is key because some of my patients are like, what? I didn't know if I had coffee that I wouldn't be able to absorb my iron. I didn't know if I had this, cooking method, I can improve my iron. So that's an important element. And then other special considerations for individuals that may need more iron, that you need to kind of be careful. And then I'm going to throw in there also some ways that we can um, kind of troubleshoot. As you take iron, there could be new symptoms and kind of how to troubleshoot that because the last thing we'd want is we need iron. And because the side effects, you're like, I'm good. I'm just going to be fatigued the rest of my life. Like, let's work through that, right? Because it's possible to work through it. So first of all, how much iron? And I'm going to talk about three terms here and a fun way to remember them because I'm sure you already can remember ferritin. What is that? That's the storage form of iron, right? The store. So I got some fun ways to remember this. So RDA is put out by the what is it? The Food and Nutrition Council. These are like official dietitian terms. Okay. So the RDA stands for recommended dietary allowance. And this will cover 98% of the people. And I think of this allowance, right? RDA allowance with like, look, if you give one child an allowance, probably need to give the other child allowance. Like, let's just cover all the children. Granted, they're of age. So that's how I think about recommended dietary allowance. RDA, hey, if you can get this amount, 98% of healthy individuals will have adequate iron. What about the EAR, the estimated average requirement? This is EAR, ear. So think about ear, it's just half of the face, right? Just one ear, singular. This is how much you need for to meet the requirements of 50% of the people. Just 50% of the people. So EAR, estimated average requirement. And then last is the upper tolerable limit, UL. And this is like, hey, this is the limit, just like a speed limit. Like, don't go above this um, because you may have unhealthy consequences by that. So upper limit. So you can kind of see like where these would be. Kind of quiz. Sure. What's the lowest? EAR, right? Estimated average, because the average 50% of people. What would be next? RDA, recommended dietary allowance. And then lastly is the upper limit. Okay. So how much iron? We're going to get to it. Here we go. So healthy non-vegetarians, and I'm going to come to the vegetarian thing too, because I don't eat a lot of meat. And so some of these things I'm like, all right, you just got to be knowledgeable. I'm not going to turn a blind eye to this information. I'm going to say, okay, I don't eat a lot of meat. How do I need to change the way I do other things because of that? So anyway, so healthy non-vegetarians. Hey, what do we see? RDA, recommended dietary allowance. So what percent is this going to cover? 98%. Um, Look at the milligrams. This is the milligrams of elemental iron. So about a year old, hey, 11 milligrams per day. What about 48 years? Again, 10. So anyone like prepubescent, like 10. 10 is like a great, like you're going to get there, right? Okay, now you get into puberty, it bumps up a little bit, 15 to 18, and then above 51. But you can see way over here the pregnancy and lactation that you're going to have a little bit higher number for if you're pregnant, and then even a little bit lower if you're lactating. Okay, now what do we see here? Henderson, you didn't teach me adequate intake. What does that mean? Well, up here, what is that for? That's for the birth to 6 months. That means it is not a specific term that's used. It's basically um, it is a like average when we don't have enough science. It's like, excuse me, we don't have enough science to get a RDA, so we're gonna have an adequate intake, and that's why we have the youngins. Sure. Throw in there little babies. If they're breastfed, there's adequate iron in the breast milk until about 4 to 6 months, and that's when it's time to supplement. So, so you can, if you have a pen and paper, this would be something I would probably write down. Hey, how old am I? Okay, I'm 35 or 23. I need about 15 to 18 milligrams of elemental iron if I am female. And male, you can write that down. And it's fun because we're going to go into sources of iron and you'll be able to see, hey, can I meet this with certain foods? So let's remember that number. All right, those with iron deficiency anemia. Remember, we're talking about adequate intake here. Those with iron deficiency anemia, and sometimes even an argument for those with iron deficiency. You might remember that difference. An adult would need up to 60 to 120 milligrams elemental iron, and I'll explain why I'm going to talk about it that way, for at least 3 months. Children It's written this way because children are such different weights and you got to go off weight, but 3 milligrams per kilogram per day, it's about 20 to 60 milligrams per day. But I think this is an important part to show a warning. Um, I think up until 2007, if you want the exact dates, let me know. But it's prior to that, they actually had iron supplements in blister packs. Why? Because there were multiple child deaths from elemental iron overload. So many people are like, oh, it's natural, oh, whatever. It's like, well, there's consequences. I don't care if you're eating tree bark and it's natural. Like, there are consequences. That's what we make aspirin from. Like, there's consequences of overdoing quote unquote natural. So it's like, okay, I know it's a supplement, I know it's over the counter, but like, we need to chat just a little bit that it's kind of their safety here. So, children, iron overdose can be fatal. Let me move over here. Um, FDA requires that this warning is under there that it's like this can be fatal if and lead to poisoning in children under 6, especially. They can have intestinal damage, organ failure, coma, death. It's kind of serious, right? It's like, ooh, how many were there? I think in like 15, 20 years, there was 44 deaths of children. That number drastically went down when they did the blister packs. Oh, and this is also interesting. They changed the coating. The coating on iron used to be sugar. Um, and so they changed it to this bitter flavor, and that also helps. So after there was like only one, I think it was one death, and like 10 years or 5 years, they said, all right, we can go to just single dosing, or excuse me, no blister packs. And anyway, so I thought about that, right? Because there's other medications that taste like junk, and I'm like, why do they do that, right? Like, why don't you make this taste okay? But this could be one element. So I put this here so that you can kind of see the amount. And what's surprising to me is this 30-pound baby, right? Where are we? Only 300 milligrams of elemental iron. That's like 4 tablets of regular, ferrous sulfate. And it's like, oof, that's not very much. So I had to throw that in there because I'm a medical doctor, because I want to keep you and your family safe. It's just important to think through. All right, so now we've got how much iron we need, whether we have iron deficiency anemia, or we are a healthy individual, non-vegetarian, gut punch. All right, so iron sources. There are 3 main iron sources. We can do supplements, which are iron salts. We can do IV, which, we do in a physician's office. And there's a lot of different forms there. And I'm going to brush on that just a little bit. And then food. And so food should be cool too. Okay. And if there are comments in the chat, just like let me know. Excuse me, I will be able to address them at the end where we kind of go through it, our discussion. Um, all right, so first, iron source and supplements. There's 2 main supplement names you're going to get on when you go shopping at, Sam's Club or Walmart or Costco. Ferrous sulfate and ferrous gluconate. Ferrous sulfate, ferrous gluconate, and ferrous citrate. So 3, but usually it's sulfate and gluconate. Why did I put this picture up here? I put this picture up intentionally. What are the milligrams that it shows? You see that? It says 324, and you're like, my Henderson, like you just told me if a child has over 300, like that could be really serious. Well, this is not elemental iron dose. That dose is actually the salt. This salt here, the ferrous sulfate, ferrous gluconate salt, that's how much that weighs. And then if you look deeper into it, it'll say each tablet contains an equivalent of 38 milligrams of elemental iron. And that's what you want to look for when you're going through these supplements. How much elemental iron is in this? Okay. Real quick, the differences, like you have ferrous and you have ferric. Ferrous has a little more bioavailability. That means you're going to absorb it just a little bit better. It's a little bit easier. All right, let me know if there's any questions here. This is a big point because a lot of people are getting their own iron supplements. But I think a big take home is how much elemental iron is in this bottle. IV iron, I'm not going to talk a long time about, but there's iron dextron, Injectafer, Venofer, Infed. That's just an injection. There are a small chance of anaphylactic reactions. 1 in 15,000 is one are some quoted statistics. There is some there are some consequences of hypophosphatemia. That's a low phosphate level in injectifer. And that is like 4% of people can get it that take that. And that's like a non-reversible condition. You can feel like junk. So I don't know, if we end up doing IV iron here, then that would be something we probably wouldn't do. Iron dextron is usually, tolerated well. But if we get to that point, that's a whole other discussion, right? Let's talk about food. So iron sources of food, we've got heme, and you can think of this as like He-Man, like I don't know. I think I'm shooting myself in the foot by doing this, but like He-Man, you think like most Americans are like, if you're gonna be huge, you gotta be like eat meat. So whatever, you can remember it that way. I don't think that's true. And then there's non-heme iron, and that's from plants. So those are the two separate sources. Heme iron is slightly better absorbed, 14 to 18%. Non-heme absorption, if I remember correctly, is up to like 12%. So not a huge difference. And you'll be able to notice from some other teachings that I share today is like you can, increase that absorption. So kind of depends on what you eat it with. And we'll go into the specific foods for non-heme plant sources, so you can know what to eat for that. So here we go. As far as the heme goes, yeah, meat, poultry, seafood, pretty easy. Yeah, there's liver. Liver usually can have some more nutrients, but usually this is in the actual like meat section, the actual skeletal muscle of an animal. Um, so now on to the plant sources, which is kind of my passion. Um, Check this out. So this is from, I believe, the USDA, and I have a link here that will give you a huge PDF of highest sources of iron and down to the least. So top to bottom. I geek out on those little like sheets. I think they're so cool to have that. It's like, what? I can know exactly how much iron I have. And they do this for like all the essential nutrients. It's just really cool. All right. So soybeans, 29 milligrams of elemental iron per cup. That's incredible. That is so much, right? That's twice the amount of most individuals that are healthy non-vegetarian. All right. All right. Let me just kind of spill the beans here, pun intended. If you're a vegetarian, you need 1.8 times more iron. So almost just about double the amount of iron. Whoa, look how cool that is. Soybeans already have double in just a cup. You're up to 30. So I just love plants. Let's see, white beans, 21, sesame seeds, 21. Cup of sesame seeds, that's a ton. But what about kidney beans? Hey, 15. Lentils, pumpkin seeds, black beans, chickpeas. These are kind of highest on the list of just plant sources of non-heme iron. So next, we're going to get into the section of what are those that will inhibit absorption and those that will enhance absorption. We're going to start with the inhibitors. So coffee, tea, calcium, phytates, polyphenols. Let's go into phytates, polyphenols first. These are elements of the plant, period. Okay, polyphenols are so cool. In my office, that's why I have these like aromatic rings with moss in it because they represent polyphenols. Why? Because polyphenols are the coolest thing ever. In plants, there are substances that the plant makes to protect itself against the UV rays, to protect itself against predators, to protect itself and enhance nutrition that it receives. And it's just like there's all these like things that it does to protect itself. And when we eat these plants, it passes those things on to us. I think that's so symbolic and so cool. It gives me chills. I love polyphenols. But we're seeing what it inhibits iron absorption. This is what they found. But what do you see down here? This is backwards. I'm pointing to it's not my mirror image. That's why sometimes I point here, but I'm going here. So vitamin C can counteract the inhibitory effects of phytates and polyphenols. Where do we see phytates and polyphenols? We see them in whole grains, legumes, cereal, spices, okay? So what about calcium? Calcium can inhibit iron absorption. And if it's taken within even like 4 hours. So it's like, look, just separate the timing. If you have any of your supplements, and this is like, there needs to be greater awareness of individuals with their supplements, because it's like, you got to know what you're taking and why. So anyway, if you have any calcium inside your supplements, you may consider changing the timing. Okay, I'm going to take those supplements at night if I take in my iron in the morning with a meal. Um, Calcium is in dairy, and also calcium supplements. And then coffee and tea, there's tannins and stuff. Um, it can decrease absorption of iron by 60 to 90%. Now that's mind blowing because there's a lot of people that have coffee and tea. Um, and this would be like, green yellow leaf tea stuff, not like herbal tea. Um, that's a lot of percent. If there's an individual that I have that I'm helping and work through iron deficiency, especially iron deficiency and anemia, and their iron levels are not coming up, this could be why. That could be like the sole reason. Like that is the root cause. Like, look, you're taking supplements and we're can't get absorption. Why? You're not absorbing it because you're having coffee. Like, so it's kind of fascinating, right? They found an individual, and this was in the a huge study, and this was more over elderly individuals. And they just said, hey, let's get your ferritin level, which is your storage form of iron, as you remember. Those that drink coffee just once a week have 1% less ferritin or lower ferritin. So kind of cool. Got some inhibitors here. Let's go on those that can enhance. If you're doing these, you can increase the absorption of iron. Cooking method, I thought this was super cool. Cast iron, right? Little Dutch oven. If you're using Dutch oven, you can increase absorption by 1 to 3%. 1.5. 1% is not a real increase. But 1 to 3 times absorption. If you're only absorbing 20%, that jumps it all the way up to 60. That is incredible. Okay. Animal protein. Animal protein can enhance non-heme iron. What is non-heme? Remember, like non-heme man? Plant. And then if you, yeah, just kind of combine that. That's the way to get there, get that enhancement. And then vitamin C improves again non-heme. Non-heme is usually that which is in a supplement, usually. Um, and then, oh, this is my favorite part. Okay. All these things that inhibit stuff, inhibit absorption. Well, here comes vitamin C to the rescue. Usually, when you have vitamin C, it can counteract the inhibitory effects. And that's usually of the plant foods. I didn't see that any data that showed that for the tea and coffee. All right, so here's some special considerations. Medications. Levodopa, not a super common medication. That's for restless leg, and that's also for Parkinson's. Iron decreases absorption there. Next, levothyroxine. Okay, Synthroid, medication for thyroid, hypothyroidism, low thyroid. That levothyroxine, the iron can actually decrease the absorption of levothyroxine. I'm not going to go too off on this, but something really tricky with levothyroxine and hypothyroidism is sometimes you don't feel dose changes for like 4 months. Like the symptom change and improvement from your medications don't take a long time. So if you're taking iron, all of a sudden the dose like you don't feel as well. It can take a long time to get this better. So it's a good idea to keep to know about that. And usually you don't take levothyroxine with food anyway, but especially iron, you want to separate it by at least 4 hours. So we've got now iron and calcium and levothyroxine. You got some separations here. Also, proton pump inhibitors, Prevacid, Prilosec, that can decrease absorption of iron. I got two other special considerations: vegan, vegetarian. Here I am, yada yada yada. Biggest thing: add vitamin C. Vitamin C rich foods are citruses, are bell peppers, are kiwis, and others. And again, you can go to that same link and then search vitamin C and get this huge list. All right. So, and we could see, right, even with soybeans, kind of, you have a ton of iron. Anyway, pregnant, menstruating females, elderly, poor absorption, if you have leaky gut, if you have celiac disease, we need to really look at this. Hey, we're trying to give you iron through the mouth, but yet you can't absorb it. You have leaky gut, you can't absorb it, you have celiac disease. Like we need to adjust something. All right, so a couple more things, side effects. Iron, people don't like iron. Like it just can taste nasty, as we now learned why. it can just like cause us like some nausea. It's like, ugh, like, do I really have to take this? Well, there's some ways that can help. One, taking with food, um, and then also like sometimes changing your dose. Sometimes that can help. Sometimes how much you take. I'm going to go off on a little tangent here. They actually did a lot of studies that said how often should you take iron, and it used to be like twice a day, 3 times a day dosing. And there is a inhibitor inside your body called hepcidin, which will decrease absorption. And that hepcidin actually is increased when you take iron supplements. Like it's kind of resistant. Like you take the iron supplement and hepcidin goes up, and it's like we don't want you all here. Like we're going to decrease this absorption. That lasts about 24 to 48 hours. So, dealing with the side effects here, some people will do once a day. Some people will choose to do like every other day. And some data shows that you're going to have just the exact same amount of effect in your labs and improvement symptoms, even with every other day dosing. That can really help with these side effects, wherever that is. Um, so implementation. This is something that we do in our clinic, and you've heard before, but this is the LCTR method. We learn, we choose, we track, and we review. And this is kind of like, I think this is the absolute best way to make change. So first learn, like, where are your levels? Like, where's your ferritin? Where's your iron? Where's your red blood cell count? Where's your intake? I recommend people with Chronometer, Chronometer, Chronometer. One of the best apps that gets, government um, recommended, like the Food and Drug like Administration. Chronometer will get the actual levels of certain foods and help you identify what micronutrients you're taking in. It's similar. They use that link that I had to know exactly how much you can get from certain foods. So where's your intake? Track all your food on Chronometer for 2, 3 days, and let's look at iron. Okay, where are we? And then where do you need to be? Are you someone that needs to have a higher dose per day, or are you fit, the recommended dietary allowance? You're healthy, non-vegan, that's what you need. Okay, so learn. Where are you? And then where do you need to be? Next is choose. Do we have supplements versus food versus enhancers? Like, what's our path? Let's just choose it. And then we track that path. You know, daily intake, some side effects, just how's it going? How are you doing? Following the plan. And the lastly is review. Let's check labs again. Where are you on this level? Um, um, and are our labs improving how we anticipate? Usually, if someone has iron deficiency anemia, we want to see one improvement or 1 milligram per deciliter improvement of hemoglobin per month. Ferritin levels, ideally, optimal is above 50. Those with alopecia, usually females with hair loss, restless leg syndrome, we usually shoot for 75 to 100 for ferritin. And that's what we're reviewing. Okay. Do we need to change? Do we need to change the plan? Are your symptoms improving? We just really review here and then we go back up, you know, to choose and track. And we just kind of rotate, do this cycle. So it's kind of fun. Troubleshooting real quick, constipation. This is common for some of my patients. Sometimes you can go to every other day dosing. You can take with Miralax. You can increase your fiber intake. You can increase your water intake. You can habit stack it and say every time I have my iron, I have 2 bottles of water. That's just what I do. I'm giving an example here. Nausea, same thing. You can have it with some food. Poor absorption. If you have sleeve gastrectomy or, Roux-en-Y surgery or other things, we need to talk. And it's something may get to the point where it's like an FDA approved indication and the insurance will pay for is like, if you're not tolerating oral iron, we can give you IV. But again, there are risks of IV iron. So we try to go off the supplementation. All right. Well, that is it. Thank you for coming, being here. I am super interested in what you learned today, and would love for you to share that. And any questions you have, be sure to put them in the comments because we'll be able to work together through that. Here's some of my resources, and again, I'll be sending this stuff out um, here yeah, I'll send it out to you. So, iron, let's get it so we can keep you strong, and doing what you love to do best, whether it's a mom, whether it's a son, whether it's a grandparent, because your life is worth it and what you contribute to other people's life is worth it. So keep it up.